Coming up, we'll be on location at the Center for Acupuncture and Wellness in Annapolis, Maryland, discussing the benefits of acupuncture and how they can treat many health problems and improve your overall health with one of this region's top acupuncturists, Lisa Kelly. Lisa is a licensed acupuncturist and received her master's in acupuncture from Maryland University of Integrative Medicine. She is also a registered nurse and combines the best of Western and Eastern medicine in her practice. Welcome, Lisa. It's a pleasure having you on our program.
Thank you so much. It's a pleasure to be here.
It's your first time, in fact, on our Top Doctors interviews. We have a lot to talk about. We have a couple of patients that are going to be joining us a bit later.
Yes.
But I wanted to begin, if I may, Lisa, by asking you if you can please tell us how long acupuncture has been around to treat health problems.
Depending on what information you look at, acupuncture's been around from anywhere from 2,000 to 5,000 years.
My goodness, we're
It's
talking
a long time. Yes.
And how does it work? Because it's helping so many people. It's become a lot more widely accepted, and people now realize that it is really a first option in many cases before surgery and medicine.
Acupuncture is all based on qi, or energy, and how it flows through the body. In Chinese medicine, there's a saying, if you have a free flow of qi, or energy, then the body's healthy. If the qi is blocked, or it's not moving easily, then that's when we have pain and illness. So acupuncture works to keep the qi moving.
Very interesting. So when there's a blockage, as you just said,
Yes.
of the normal energy flow, which
Yep.
is the qi in our bodies, then that blockage is what causes that pain that we may suffer in different parts of our body.
Absolutely. And illnesses too.
So then how does acupuncture help us remove these blockages that cause these illnesses and pains that so many of us suffer from?
So with acupuncture, when we insert the needles into the skin, we help to facilitate the movement of qi, help to remove any blockages, or to build the qi. It's like with having a car. If you don't have enough gas in the car doesn't work. So that's what the needles in acupuncture do. They help to either put that gas in the tank of the engine, or to help move that qi around.
That's a wonderful example. I think we can all understand and relate to that. You're absolutely right. And that's what acupuncture does. It puts that gas back in our engine, so to speak, or corrects any blockages that
Exactly.
were preventing it from going through our whole bodies, which is the energy, the qi that you mentioned.
Right.
And how exactly are acupuncture treatments performed? Now, you mentioned the needles, and can you please elaborate, tell us a little bit more about how it works, specifically with the treatments?
Each treatment's different as far as what you're going to do for a patient. It depends on how they come in, what their major complaints are. Most often we have them lying on a table, and I will insert needles, which are about the diameter of a piece of hair, through the skin into certain acupuncture points. And these points, again, will either stimulate the flow of qi, will help to expel any blockages, and then they lay there on the table and relax for about 25 to 40 minutes.
That's it.
It's an easy thing.
I'm sure it varies based on each particular patient, his or her
Right.
situation, but in general, how long does a treatment typically take, Lisa?
A treatment typically takes about 45 minutes, and that includes the time to sit down, talk with the patient, because it's very important to find out what's going on, because day to day, symptoms change, how a patient feels changes. So we talk, and then I have them relax. There's a lot of school of thoughts that you can just put a needle in and do whatever you're going to do with it and take it right out. I've found that a lot of people today, we don't relax. And so by having that time to lie on the table with the needles in, with some music, and you just relax, it really benefits even more.
No, that's a great point, Lisa. There's too much stress in society, unfortunately,
Right.
and all these things result in various blockages, you use that term, for our energy flow, which do result in problems or even illnesses. Unfortunately, over a period of time, in acupuncture, from what you just described, is a wonderful treatment option where we can not only get back to feeling the way we should and having the pains gone, and also treating the illnesses. And we're going to get into that in a moment, but it really also gives us that chance to decompress and really get our energy in that the right mode that we need to be in, sometimes that we go off the road with the stress, unfortunately.
Right, and then once we address the issue that people have initially come in for, it helps to stay healthy.
Yes.
Because acupuncture was meant to be a preventative medicine. It was meant in olden times to stay healthy. This is how people stayed healthy.
Now, speaking of health problems and
Yes.
different types of problems that people experience, who out there watching right now would you say would be a good candidate, Lisa, that can benefit from acupuncture?
Actually, anybody. There are so many things that acupuncture can treat. Some of the major issues that I see in my practice are pain, allergies, insomnia, stress and anxiety, infertility, problems that occur as we age, menopause, that lack of energy.
So you're talking about a lot of people watching right
Absolutely.
now. Pretty much everyone would fall into one or more of those type of situations.
Absolutely, chronic illnesses,
Yes.
everything. So the only thing I say as a caveat, I can't promise you it's going to cure cancer. And it won't fix a broken bone,
Yes.
to my knowledge.
Yes.
I guess in theory it could, but I'm not going to tout that.
Okay. Now, how do you diagnose or determine for each particular patient that comes in here what particular acupuncture treatment, customized option is best for them?
Again, as I said before, everything is personalized. So we sit down, we talk about symptoms. I'll ask about other areas of their life, how they're sleeping, how other body functions are occurring, so that I can get some diagnostic information that way. I also look at patients' tongues, because tongue diagnosis in Chinese medicine is a very good way to see really what's going on with the body.
Very interesting.
Also use pulses, and then I'll touch the body and see where they're hurting, ask them how the pain feels. Is it sharp? Is it dull? Is it better if I push on it? Is it worse if I push on it? So there's lots of different ways to look at what's going on, and then I put it all together to come up with a treatment.
That's certainly good to know. Very comprehensive approach from what you just said.
Yes.
Now, what types of results can we expect from these acupuncture treatments, Lisa?
Again, everybody's different. Most people after the first treatment say that they felt very relaxed, which I think is a great thing. Whether it depends on what they're coming in for. When somebody comes in for pain, I expect that they will receive some relief at the end of the treatment. How much depends on what type of pain and how long the pain's been going on. And then how long they have relief. It could vary from a few hours to a few days, and occasionally somebody their pain goes away and they don't come back. For diseases or other issues, stress and anxiety or chronic disease processes, sometimes the results are a little more subtle. But they'll come in and say, wow, I slept better after that treatment. I haven't slept for months.
And that's major.
Yes.
Because you're right, it's not always the obvious, I feel there's no pain after I left my first treatment. That we all can feel
Exactly.
and realize that's happening. But the subtle things actually affect the quality of one's life.
That's right.
Sleep, for example, as you just touched on.
Yes.
So you start feeling better, sleeping better, which means their family's happier, their
That's
significant
right.
others, they have that bounce back in their step, right?
Right, and it affects everybody.
Yes, indeed. Now, I wanted to ask you, Lisa, as far as these very thin hair-like needles
Yes.
that are utilized in acupuncture, is there any pain associated with it?
Sometimes you might feel a little prick when the needle goes in, and occasionally people will feel what is termed as the chi, and which is a deep achy feeling while the needle's in. And although that might be a weird sensation, it's actually a good thing, because we know that we're moving. that Chi.
Yes, indeed. So it's very little to minimal pain, if
Right,
any.
and once
depending.
the needles are in, most people don't even realize they're in any longer.
Okay, well, that's certainly good to know. I appreciate you letting us know that,
Sure.
Lisa. We're now going to meet a couple of Lisa's patients. Welcome, Ann. It's a pleasure having you on our program.
Thanks, it's good to be here.
Well, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Ann, by asking you if you could please tell us what problem or problems were you experiencing that brought you to Lisa?
Well, I broke my back about 2 years ago, and I'm a diabetic, and I've had residual pain since. And being a diabetic, I don't like the thought of taking narcotics or pretty much any medicine that I don't have to. And I've known Lisa for about 20 years, and knowing that she does acupuncture and I trust her completely, I decided to come to her for that and started getting some acupuncture on my lower back.
That must have really been affecting you, the pain that you were experiencing prior to coming to Lisa on that lower back.
Very much. Daily activities, it also affected my diabetes, some of my blood sugars, and just, as I said, doing everyday activities, getting groceries, picking up laundry, and the acupuncture has kept me off of medication. It's kept me off narcotics and all medication for the pain. The acupuncture alone has done wonders for me.
How often do you come to Lisa?
I come to her about every couple of weeks.
Okay. And how long does a session take, if I may ask?
Honestly, the initial session took about 45 minutes to an hour, going over my history and an interview and her explaining in detail everything that she was going to do. But then the other sessions only take about 30 minutes.
That's wonderful. And any additional comments or thoughts you'd like to share with the viewers before we let you go?
Yes, for anyone that's nervous about acupuncture, don't be. I know there's a lot of falsehoods out there that, oh, it hurts. It does not hurt at all. And it does wonders, and it can treat so many different illnesses, pains, sleep. I'm going to be having her do acupuncture in my ear for my problems with sleeping as well, allergies. There's so much out there that acupuncture can help, and she's a wonderful source of information as well, and spends a lot of time with her patients explaining everything and talking about their history and what it can help. And I think she's a great asset, and I'm really happy that she's received this certificate.
Oh, that's wonderful. And on that note, we'd like to thank you, Ann, for joining us, sharing some of your experiences, and being a guest on our program.
Sure, anytime. Thank you.
It's our pleasure. Welcome, Darlene. Thank you for coming down as well.
Thank you for having me to speak about Lisa.
Well, I wanted to begin by asking you, Darlene, if you could tell us what were you experiencing that brought you to Lisa as well?
I have a condition that's called complex regional pain syndrome, among other things. That's not a clearly understood disease. And I was seeing one of the top pain management professionals in the area, and he had me on several opiates, and it was not taking care of the pain. On a pain scale, they usually have you rate it from 1 to 10, and mine was like 10 plus.
Oh my goodness, I'm so
Yeah,
sorry to
even
hear
under
that.
opiates. So we got the opiates out of my system and needed an alternative method in order to address the pain.
Okay.
So he actually recommended Lisa to me. A pain doctor recommended Lisa.
So you were experiencing that pain.
Yes.
The medications weren't doing the job.
Correct.
You then were referred to Lisa by your pain doctor.
Yes.
And what happened when you got here?
Came here after the referral and met Lisa, and she did several treatments on me. She was very thorough on her questions to me in order to get a clear picture on what my problems were.
Oh, and what basically was the customized treatment option that you went through over here? Were there multiple acupuncture treatments a week for in the beginning, or what was your treatment situation?
She used different methods to address the immediate pain. There's a procedure called battlefield acupuncture which was developed in order to treat guys that are out in the battlefield where they can't have immediate medical attention or surgery, or they don't want to be on medications, and she used that. I also had needles that were put in me in several different locations, had some electrical stimulation to take care of some of the problems, and also there's actually flat needles that she can put in your ears that stay in you for 3 weeks that take care of you after you leave here.
Very interesting. In fact, I believe we're going to get some footage of you going through that exact treatment a little bit
Yes.
later with
Yes.
Lisa. Now, as far as how you feel today, Darlene, that's what's most important. How do you feel today after these acupuncture treatments?
I have about at least half as much pain as when I started seeing Lisa.
Well, I'm very happy to hear that. So there's been a significant improvement.
Yes.
That's wonderful. And before we let you go, for all the folks watching, Darlene, is there anything else that you'd like to share with our viewers?
I think Lisa has a unique approach because she had a Western medicine background with her nursing program, and she also has now the Eastern medicine. So she has a unique approach that can look at what you have going on and see how they can mesh together.
Well, on that note, we'd like to thank you as well, Darlene, for sharing some of your experiences and being a guest on our program. It was our pleasure having you on.
All right, thanks.
Thanks. Both Ann and Darlene, very happy with the results. Their quality of life is back. You can definitely tell that they're very pleased indeed.
Great.
Now, we're literally out of time, Lisa, but I wanted to ask you before I let you go, you and your practice, Center for Acupuncture and Wellness here in Annapolis, Maryland, have established a reputation for excellence, not only as a top acupuncturist, but also in patient care. And I just wanted to ask you what you feel helps separate you and your practice apart from the others.
Well, I think that one of the things that really separates me is that I'm a nurse. And I've been a nurse for 28 years. So I have a great background in Western medicine, and I understand what's going on when people come in. And I can look at it from both the Eastern and the Western medical diagnoses and really formulate a treatment that's best for them. I also am proud to say that I am the first licensed acupuncturist to work at Walter Reed National Medical Center and to treat the military and retired and their families. And so I've experienced and gained a lot of knowledge while working there that I have brought into my practice that otherwise I don't know I would have been able to do. So now I'm able to offer a lot of different treatments to my patients. So it's really an honor to be able to work with our military and to treat them. It's just brings a lot of satisfaction to have somebody come in with some life-changing injuries and to be able to see the changes that acupuncture has made it. And some of those patients say that acupuncture is the only thing that helps.
Yes, indeed. You have quite the background, especially being a registered nurse and a licensed top acupuncturist, and combining the best of the West with the East and taking care of your patients with customized treatment options. And you certainly, like I said, Lisa, established a very strong reputation in this region. Well, on that note, we'd like to thank you, Lisa, for joining us and being a guest on our program. It was our pleasure having you on.
Thanks so much. It's been a pleasure, and being able to talk about acupuncture and how it doesn't have to be just Eastern medicine or Western medicine, and my hope is to get out to people how they can combine them both to be the healthiest that they can be. So
yes,
thank you.
It was our pleasure, and we'd love to have you back on in the future.
Thank you.